Hi everyone, my name is Pip. I work at Sydney Advanced Physiotherapy, and we thought we would talk a little bit about diet and the body and pain today, and we have the lovely Lisa joining us.
Hi Pip, great to be here talking about health and diet and how we can help both of our clients with some of the main issues and complaints that they have. So my name's Lisa Snowdon from Vibrant Nutrition, and my clinic is in North Ryde in Sydney, which is fairly close to you. I also do lots of Zoom work, so via video, just like this one. So for the pelvic floor, what is most relevant, from your side? What can you help with the most?
So when you look at the pelvic floor, you've got to it's like important for sexual function, and it's important for bladder bowel function, and it's also part of your core stabilizing system. So from those three perspectives, you actually really want to get this area nice and functional. Yeah. The pelvic floor goes from hip to hip, so it can really affect your back and your pelvis, and obviously your hips, if the area is not functioning all that well. And if you think about any muscle, really, you want it to have like full range of motion. If I'm looking at my bicep, it's not going to be all that useful to me if it only works from here to here. So often we have to teach people to let go so that their pelvic floor can lift and squeeze properly to actually provide better functional outcomes.
Yeah, right. Yes.
So that's a lot of what we do. And also there's, we step in a lot with early prolapses and things like that. Yeah. So often if you were to ask a gynecologist or a GP or whoever to check you for a prolapse, often they'll only tell you if it's a really significant one, or they might not pick up the small ones because you've actually got to Valsalva and bear down to find some of them. And we can actually have really good impact with treating the early ones, and you stop them from getting worse. And it obviously has exercise implications, which, you know, the less you exercise, generally the slower things move through your gut, and that can then have, again, pelvic floor effects in terms of whether you can actually pass bowel motions comfortably, whether you get constipated, and all of that sort of thing. So we kind of come in.
It all links together.
Yeah, from all aspects. So if you look at the pelvic floor itself, so you've got the bowl of your pelvis, and your pelvic floor, or what people think of as your pelvic floor, is a series of muscles that sits along the bottom. So they attach from hip to hip, they attach from pubic bone to coccyx. So how well those muscles function, how tight they are, how well they can contract and relax, has an enormous impact on your alignment. So for example, one of the things that we really commonly find is that when people are trying to do a pelvic floor contraction, they're either bearing down, so they're pushing the wrong way, or when they do contract their pelvic floor, they're pulling on very hard on their tailbone. And what that does is it kind of pulls your pelvis into one of the more unstable positions you could be in. So if you're trying to activate your pelvic floor to assist from a core perspective, to assist with, you know, leaking in exercise, we need to teach people how to activate without actually essentially taking their coccyx hostage, because then they're just pulling themselves out of alignment. And the same goes with the hips. And the pelvic floor, I mean, things like if you're looking at sporting activities, it can often be that the muscles aren't relaxing or contracting in the right pattern, or that your base resting tone is not enough. So we can look at that. But the really big thing to note with the pelvic floor is, so if you look at a woman, they have an outlet like this, and through that outlet comes basically your three pipes. So for urination, you've got your vagina and you've got your bowel. And that shape can be different sizes in different women, and that can predispose you to having an increased risk of prolapse. So that's also something that we check. And when people tend to talk about pelvic floor, they're often talking about the pelvic organs as well, and the tissue that suspends the organs within the body. So it's really important when you're looking at pelvic floor to have a look at not only the deep and superficial pelvic floor, but also what are the pelvic floor organs doing, and what are the surrounding areas, so your lower back, your pelvis, and your hips doing.
So we all need to be doing pelvic floor exercises, but we need to do them correctly.
Sort of. So not everybody needs to do pelvic floor exercises, like in the way that people think of like Kegels.
Yeah.
So some people can actually be quite tight in their
Over.
pelvic floor. So really common postnatally, especially when people have had episiotomies and tears and things like that. Also common in men following prostate surgeries and things like that. And sometimes they can be tight and strong. Usually people are tight and weak. So they actually need to learn to let go first before you try and strengthen. Because if you try and strengthen a muscle that isn't functioning well anyway, it's not going to work that well. But if you think of a tight pelvic floor as a gripping muscle, if it's already working, it's very hard to strengthen something that's kind of on already all the time.
Yeah. So that can contribute to the constipation in some people.
Absolutely. So there's a particular muscle that you can activate to kind of essentially kink off your bowel if you're trying to delay going to the bathroom for whatever reason. And you have to relax that muscle in order for the bowel to kind of come into the right shape for you to pass a bowel motion. And sometimes that muscle can actually be high toned, so more switched on than we would like it to be. And people can really struggle to actually relax that muscle. And so then you kind of get fecal impaction, which is basically like the traffic gets backed up.
It's not good and not very comfortable as well. Are there any things that with the loose stools, the diarrhea, so the things that people can do from a pelvic floor perspective?
With a loose stool, we're generally pretty keen to know what they're doing from a dietary perspective. Really commonly, there's IBS, or like people like myself, I'm gluten intolerant. I'm not celiac, but you know, if I succumb to the great joys of garlic bread, it's all over.
Yeah.
And so you want to have a look at what people are doing, and obviously you want them to have enough pelvic floor strength, whether you're talking bladder or bowel, to actually be able to, number one, sample and kind of be able to tell the difference between gas and something else, and then be able to make it to the bathroom if they need to go. And so there are, particularly for the bladder, there are some nerve deferment strategies that you can kind of use to try and reduce the urge to go to the toilet. There are, for both bladder and bowel, some strengthening things you can do. Sometimes we need to get people to go and see like a specialist, like a urologist or their gynae or their GP, because sometimes there are medications that people might need, whether they be temporary or ongoing, depending on their medical situation, that can help, like with, particularly with the bladder, because sometimes the bladder can just contract at inappropriate moments. And if you've got decent pelvic floor strength and that's still happening, then sometimes people can need a medication to actually calm that down. But often, particularly with bowel, it's diet.
It's over to me and the food side. Yeah. Working out those triggers. Right. Okay.
So generally with endometriosis, one of the things we see is pelvic floor spasm, and that can come and go. So sometimes people only get that pelvic floor spasm around the time of their period. And sometimes for people in more severe cases, that can be more of a chronic situation, which can obviously make sex uncomfortable. It can make passing a bowel motion uncomfortable, and it can give them a lot of pain. It's just with diet, what are the most effective strategies you feel like for bringing down that inflammation and trying to reduce the strain in that general region, because it's already under some stress?
Definitely. So the gluten is a big one. I really find so many people with endo feel better off the gluten. The bloating goes down because it's hard to tell what's coming from the bowel or what's the endo pain sometimes. But the gluten does seem to really help people. So coming off that, and then the dairy would be the second one. But we can also look at the other inflammatory foods like the sugar, the alcohol. Some people the coffee, but it depends. If it's more of an acid alkaline issue, then the coffee can be relevant.
Okay. And what is the difference between Fodmaps and the elimination diet? Are they the same, or are they different, or?
Yeah, so they are a little bit different, and there are lots of different elimination diets as well. So there are different food chemicals that people can be sensitive to, but the general elimination diet that I do with people that's not low FODMAP is the gluten, the dairy, sometimes eggs and soy and corn are the next common ones that we look at. So they're kind of the 5 top food intolerances. Whereas when you're looking at FODMAPs, that's more about your bacteria and how your bacteria responds to the food.
Right.
That ferments these certain FODMAP groups and causes the gas, which then affects the bowel movement. So one is more you and your immune system responding, and the other one is your gut bacteria, and both can be problematic.
Great. Well, hopefully people with questions about pelvic floor and digestive issues have found this video useful, and they can find us at sydneyadvancedphysio.com.au. Where can they find you, Lisa?
They can find me at vibrantnutrition.com.au, and I'm sure we have lots of answers between us, so that would be good.
Cool. Thank you for your time.
Thanks, Pip. Bye.